So for a donor, when they come over for an IVF cycle, to undergo an egg retrieval, we have to usually start with birth control pills in Japan for a few weeks, followed by, when they get here, we start the gonadotropins. It's an injectable medicine that the donor will take for approximately 10 days. They're subcutaneous injections, just go right under the skin, and the donor will give it to themselves, or someone else will help the donor if needed. In the process of those 10 days, the follicles will start growing. The follicles are where the eggs are. And then once we see that the eggs are ready, we then schedule for the egg retrieval. The donor will come in, undergo the egg retrieval process, where we will take out the eggs and count the number of eggs that are available. During the donation process, I always tell my patients that they should continue their normal activities. So if you are exercising, it's okay to continue to exercise. Now, the ovaries will get larger and more sensitive during the process, and the ovaries will typically tell you if you need to stop. So if it hurts, don't do it. If it's uncomfortable, slow down. Okay, but in general, if donors can exercise or undergo their just normal activities, we tell them to continue doing it until the ovaries just are too sensitive to do that. The risk with egg donation is very minimal. There are some injections that you take. The risk with getting a subcutaneous injection, having like a skin infection with that is less than 1%. There's also, during the course of the IVF cycle, taking the eggs out, putting a needle into the ovary. There's a small risk of infection or bleeding when we do that. We do put patients on antibiotics prior to the process. We're very careful so that we don't damage the ovary. But there is some bleeding that's associated with it, but it's very minimal. It's very rare for anyone to have a complication that would require extended antibiotics, like an infection, or need to go to the hospital or the emergency room, or need a procedure after the egg retrieval. So in general, the risk is less than 1% for anything. When you combine all of this together, less than 1% of donors would have anything that's significant. So during the egg pickup or egg retrieval, you do receive anesthesia, and so it would be a very uncomfortable process if you didn't get anesthesia. We give you anesthesia, you breathe on your own, but you do get the anesthesia so that you're basically taking a nap or sleeping while we take the eggs out, because we do have to put a needle through the back of the vagina into the ovary, and sometimes multiple times in order to get all of the eggs. So it would be a very uncomfortable process if you were awake, but since you're sleeping, it's fairly comfortable. There is some discomfort before and after the procedure, mainly because the ovaries are just really big and sensitive. But it's more discomfort than it should be a lot of pain. So unfortunately, there is a small risk of cancellation once the donor arrives here in Hawaii. There are two reasons typically why you might get canceled. One is when you get here, we have to do infectious disease testing for the FDA here in the United States. And if one of those labs comes back abnormal, then that could cause a cancellation. The other reason for cancellation is if during the medication phase of the cycle, the ovaries don't respond well and you don't produce enough follicles or enough eggs, then that would be a reason for cancellation. Very rarely a donor might get sick or not feel well, and that could potentially be another reason for cancellation. But all of those risks are very low. We typically have 1 or 2 cancellations a year, so not many. So if you're not feeling well during the donor process, it really kind of depends on what the feelings are. If this is kind of a general illness, a cold or something like that, you definitely should let your agent know, and you might need to go to the acute care clinic here in Hawaii. If it's related to what we're doing, the stimulation process, then you would let your agent know, and then they would let us know. A lot of times it's just that the ovaries are real sensitive, and you might have a little bit of bloating. Your stomach might be a little upset. In general, as long as you let somebody know, we will figure out what the cause is, and then need to treat that appropriately. So after the egg retrieval, you're always welcome to contact us if you have issues. Typically you go through the agent, they let us know. But immediately after the egg retrieval, as long as you're not going to be leaving right away, we always have the donor follow up with us, either the next day or the day after, for an ultrasound, so we can look at the ovaries and make sure everything looks okay after the egg retrieval, prior to you flying back home to Japan. If your donor cycle is canceled, the injectable medicines that you've been having really don't have any long-term effect on you at all. Okay, the short-term effect is they're just getting the ovaries to respond better, they're causing more follicles to grow and more eggs to be released. The one issue that is a concern is that, if you're having 5 or 6 or multiple eggs being released and you get canceled, then definitely you want to be careful with intercourse, especially use protection, because if you have unprotected intercourse, you could then end up with triplets, quadruplets, quintuplets, just because there's so many eggs. And that's really kind of the biggest risk if we have to cancel, is the number of eggs that might be released, and then possibly a pregnancy from that. After the egg retrieval, normally you'll have your menstrual cycle in about 2 weeks. Okay, within about 2 weeks after the egg retrieval, you'll have your menstrual cycle, and then the menstrual cycle should go back to whatever your normal cycle is. If your menstrual cycles were previously irregular, they're still going to be irregular. If they were previously regular, coming once a month, then that's what should start happening again. So, because you're an egg donor, that does not change your future fertility. So you might have difficulty becoming pregnant in the future, but you're going to have that difficulty regardless if you're an egg donor or not. Being an egg donor doesn't help your fertility in the future, nor does it hurt your fertility in the future. During each month, there's a number of eggs that start growing. One normally will ovulate, and the rest will die off. And that happens every month. Whether you're on birth control pills, whether you're pregnant, happens every month of a woman's life. Even when you're 5 years old, that's happening. Except that it's not ovulating, you just have them dying off. There's a cohort that just dies off every month. During the donor egg cycle, what we do is we basically just rescue those eggs. So that entire cohort, instead of one growing and ovulating and the others dying off, we're basically capturing all of those eggs so that those can be used. So the number of eggs that you have is not deplenished during the course of a donor cycle. No matter how many donor cycles you do, the number of eggs isn't deplenished. Your fertility is not changed. Your risk of going into early menopause or anything like that is not changed at all. So in the United States, the recommendation is that donors should not donate more than 6 times. Now, there are a few exceptions to that, but in general, 6 times is the number of times that a donor would be allowed to donate. During the donor cycle, when you're getting the injectable medications, we do have to monitor you, so we do have to do some ultrasounds. Normally, we will see you about 5 times during that 2-week period that you're here. Most of those visits are going to be fairly quick. You come in, you do an ultrasound, you get some blood drawn, and then you talk with your nurse to go over the process. Actually, I alluded to this earlier. The number of follicles in your ovaries is not changed after an egg donation cycle. It doesn't matter how many egg donation cycles you undergo. the number of eggs that you have is not going to change. Each month, again, there's a number of eggs that are either released or die off. An IVF cycle or a donor egg cycle, what we're doing is we're just allowing us to retrieve those eggs and use those eggs. It doesn't change your fertility status or menopausal status in the future. So the qualifications for being an egg donor are typically just, you have to be young, so typically somewhere in your 20s, and fertile. And so that's really the two main qualifications for being an egg donor. After that, we also make sure that you're in good health, and that there are no infectious disease risks associated with you donating eggs. So the egg pickup definitely is always one of the questions that we get. What's an egg pickup going to be like? Is it going to hurt? Again, during the egg pickup or the egg retrieval process, you do get anesthesia, so you're taking a nap. You're breathing on your own. You're not intubated. You're breathing on your own, but you do take about a 10-minute nap while we take the eggs. During that process, what happens is there's a vaginal ultrasound, and on the vaginal ultrasound, there's a little needle that goes through the back of the vagina into the ovary, where the fluid in the follicle is aspirated or removed. That fluid then goes into the lab, and the lab looks through that fluid for the eggs. Again, the process takes 10 or 15 minutes. After the egg retrieval, when you wake up, there is some abdominal discomfort just because you've had the procedure. We give you pain medicine to help with that. Usually within about an hour after the egg retrieval process, you're back to normal.